This short film talks about the guide for people working with people with dementia. It's from the Living Alone with Dementia project, and it's aimed at practitioners and providers. We did this research project because people are living on their own with dementia and without informal support. And we wanted to find out what would support them and then work with stakeholders to develop useful resources. One of the resources that we produced was a guide for people working with people with dementia. The guide provides key principles for practitioners and providers about how to offer good support to people living alone with dementia and without family and friends nearby. There's information for each principle about why it matters and what's needed. The guide then has an approach based on NICE guidance to help you think through how to support people, followed by examples of how this is being done. The guide was developed by the Living Alone with Dementia research project team. To develop it, researchers carried out an audit of services and interviews with people living alone with dementia. They shared the research with stakeholders, including people with dementia, providers, practitioners, and commissioners, and they co-developed key messages with them. They then produced draft resources and gathered feedback from stakeholders before finalising the guide. The principles cover how practitioners and providers can offer good support. There's information for each principle. Recognise that there's a whole different set of priorities and issues for people living alone with dementia and without informal support. Be proactive and responsive. Make sure that any support that you offer is accessible for people on their own. Help people to map and grow their networks. Recognise the importance of emotional support and plan with people for change and contingencies. The approach in the guide is about what's different when you're working with people who live alone with dementia and don't have informal support. It's based on the NICE guideline on dementia and then offers additional information for each area that the guideline covers. Involving people in decisions about their care. You need to consider how to involve people who live alone and don't have family and friends, and proactively consider advocacy. Providing information. You need to provide information in ways that people can take in when they don't have support, and also arrange support to help people understand and act on information. Some additional examples are to ask the person if you can flag up their situation and share information proactively with others, and to ensure that there's ongoing contact to identify changing needs for information. Follow-up after diagnosis. Some additional considerations are to make sure that it's known that this person lives alone without informal support, to enable people to access health appointments, and not to discharge someone from post-diagnosis support without something in place to follow up. Planning. Considerations are around being proactive in helping people plan ahead, particularly around decision making. Ensuring that there's a contingency plan and making every contact count as an opportunity to review how things are going. Sharing information. In this situation, it's important to agree with the person how you're sharing appropriate information and ensure there's a way of raising an alert if a problem occurs. Making services accessible. This is about checking that any service you suggest is accessible to someone on their own and making the right adjustments. Care coordination. This is about ensuring that there's a named person or service responsible for checking in with the person and that people aren't discharged without follow-up. It's also about considering specific areas in care planning that are particularly tricky for people who live alone without family and friends. For example, day-to-day emotional support or an emergency response. Staff training and education. Additionally, people need to consider how to raise awareness of people living alone and without informal support when they have dementia. They can learn from them and share learning with others. The guide includes examples that are adapted from real-life examples of how practitioners and providers are supporting people who live alone with dementia and without family and friends. For example, a dementia advice service has a home visit path for certain groups including people without family support. This means that they're visited in their own environment and support needs can be identified in their own home. There's a dementia advice service with a named contact who stays with the person with dementia throughout their journey. There's a step up, step down service that doesn't discharge people with dementia who live alone. Levels of support differ depending on changing needs, and there are regular telephone check-ins at agreed intervals. There's a memory clinic that provides ongoing support from a named occupational therapist who checks in with the person with dementia every few months at home, and also is the contact for any questions that person has, since they don't have family or friends to draw on. And there's an at-home befriending service from a charity that includes befriending for people who live alone with dementia. They would have a consistent long-term befriender who has an ongoing relationship with them and can refer back to the charity when additional support is needed. And there's a voluntary sector group for people living with dementia that was initially set up so people could come along with a relative or carer. Once the group was established, however, the facilitators realised they could open it up to people who live alone and don't have family and friends to come with them. People who live alone are warmly encouraged to attend and supported to get to the group. And some sessions are now just for people living with dementia. So carers, if they are available, can attend a session at the same time in a different room or use it as an opportunity to take a break. The main reason for all of these resources was summed up really well by Wayne, one of the advisors to the project who's living alone with dementia. It's maintaining your independence, that has to be the aim of everything, really. You can find out more and access all of the resources at our website, livingalonewithdementia.co.uk.